So we are going to start the session. Today's theme is regeneration. Something is dead, we will generate it again. You can see the stump of wood is totally destroyed, dried up. From there, within that one, some sprout came out. So that is called regeneration. From something dead, something live will come out. Though it is small, it is very important. Write down your problems related to writing. Right. So with every Zoom message link, I'll send you YouTube link also, because in case any time by mistake you miss the session, you can watch it on Zoom, YouTube. But YouTube does not necessarily mean that you can skip Zoom session. Zoom session is 100%, but YouTube session is only 50%. Not all the Zoom sessions will go to YouTube. Remember that. Okay, so don't miss any session as far as possible. Now this is writing workshop. Write down all your weak areas. Whatever problems you have, you can write down so that we can discuss. So we are going to do a lot of exercises for writing. So writing workshop means in depth. So you will work out with me, not I just teach, you will also work with me. That is writing workshop. It's not just a lecture. It's lecture come workshop. Remember that. So write down all your problems, whatever problems you have. You can share with me so that we can discuss those points. Right. Now this is the letter office selector, and here today's, yes, page 1, page 2, writing task, lecture come workshop for the day. So you have that. One and two. Right. Okay. This is a common one. Whenever I teach letters, you try to attend, whether it is nursing or medicine or whatever it is, because I'm not teaching a particular letter, but I'm teaching the, everything of a letter. So it will be for everyone the same thing. Yes. Now, Vanessa Stanley. Okay. Okay. This is writing task. Writing task. So, what does this writing actually talk about? You see here. Now, using the information, write a letter to Grace Jerome. Fine. Discharged from the hospital. So, this is a discharge letter. Okay, because he did not say anything regarding referral. So, a discharge letter. So, you can see here, bilateral lower extremity edema, cellulitis of lower extremities, and renal insufficiency. So you can see all these things here. This is a small case notes, not very big. How are you going to build this one? Is very, very important. Yeah. So You have to study the case here. I'm going to present this one. Okay, there are today we are going to deal with two letters. One is nurses and one doctors. First we'll deal with nurses, then we'll go for doctors. Right? So this is the case. Go through the case. So Vanessa, Stanley. So discharge from hospital. So discharge letter. Patient requested for home care. So is discharged back home. He came from home and is going back to home. So discharged back home. And this is the discharge date, 20th of April. Yeah. Not very clear. Not very clear. The discharge dates. So this is the date you are going to write because no other date is given. So discharged from the hospital. Okay. Not very clear. Right. So this is the letter. Vanessa Stanley, 85 years of age. 85 years of age and a lady. Right. So this is a nursing specific writing task. And you are going to write a letter based on this. Okay. Go step by step so that you learn each and everything. No hurry. No hurry at all. So now first thing is yes, there are totally 7 components. 7 components. There are totally 7 components. Yes, we'll discuss. We'll discuss all these things. So we have 7 components. The 7 components. Right. Fine. Now, what are these 7 components? The address, the date, the salutation, the subject, the body, the body, the closing remarks, the sender's particulars. These are the 7 components that we are going to deal with now. So make solid notes when you are doing, because these are applicable to everything, because there are number of new students. Okay. So previous batch and this batch, those who do not know the clear picture of writing, those who missed the sessions in the last batch and the present batch. So for these things, I'm telling you, this is not one particular letter. This is everything of writing. Everything of writing. These are the 7 components. You have to concentrate on these 7 components of an OET letter. So now let us see from where we get this address part. Now the address part, the date, salutation, subject, these are the starters. And the body is the main course, and the closing remarks and the sender's particulars are the desserts. Now what are the starters? What is the main course, and what are the desserts? Now let us, for example, we are going for a dinner to a 5-star restaurant. They'll ask you, so what do you want to start with, sir? Those are the starters. Before the main course, before the main meal, you start because till then you are famished, you are waiting for everyone, you reach the place and you're really hungry and you want to have a wonderful meal, but you cannot directly jump onto the meal. You have to begin with the beginning. You start with something light. You don't start with something hard. Okay. So what do you want to start with, sir? Then next, once you start, okay, you're comfortable, then you order the main course. It will take some time for the main course to be cooked. So before that, you start with the starters and you make some the small discussions. And in the meantime, you get the main course and you start eating that. Once you finish with the main course, then you'll ask for an ice cream or fruit salad or something else. Now these are called the desserts. So starters, main course, and desserts. So now if we separate these three things, the address, the date, the salutation, and the subject are the starters. The body is the main course. The closing remarks and the sender particulars are the desserts. Before the body, and after the body. So head, trunk, and the limbs. Head, trunk, and the limbs. Okay, fine. Now, once we got this one, we are moving ahead to the next. Number one. The address. The address. Now this address, you will start with the name, the designation, the facility, the street name, the city, the country. So let us take five things. Right, any five. So city or country will take like that. Or the street name or the town. Right. Cool. The name of the person who is receiving this, the addressee. The name of the person who is receiving this letter. The name. The designation. What is his designation? The professional title. Physiotherapist, senior consultant, senior surgeon, manager, charge nurse, community nurse, doctor, registered practitioner. Okay. So whatever you are giving, that is the designation. Then the facility means the name of the hospital. Always try to write all these things which are given in the case notes. Many people miss many different things. That's why they lose their marks. Okay. The facility means the name of the hospital. Sometimes there may be ward name also, name of the ward. Outpatient ward or inpatient ward or emergency ward or emergency department even before the facility comes. So let us take 5 different things. Sometimes there will be 6, then they will write all the 6, no problem. Full address. Don't miss anything. Then the street name, the town name or the city name in the country with its pin code also, whatever is given. Whatever is given, try to use those things. This is the first component. Right. Now let us go to the first component and finish it off. The Yeah, sorry for the interruption. That was my wife. She came from work. Okay, right. Now you can see here the address. From where do you take the address? From here, from the writing task. From the writing task. Yeah. Using the information in the case notes, write a letter to Grace Jerome. This is number 1. Grace Jerome. That's the name of the person receiving the letter. Your choice home care agency. This is the facility. Leach Hart is the name of the city. New South Wales, NSW stands for New South Wales. Remember, whenever they give NSW, many people they write as it is NSW. And remember that this is notes. NSW is a state, a region, New South Wales. And it is in the country Australia. So now something is missing. 1, 2, 3, 4, 5 are there. But what is missing? To whom are you writing? Using the information in the case notes, write a letter to Grace Jerome. Who is this Grace Jerome? You're writing to home care agency. So maybe manager of this Grace Jerome is the manager of this home care agency. Or she's a senior nurse. Or she's the manager responsible for this agency. Okay, we have to find out where it is. Okay, if anything is there, read the case notes and complete the writing task which follows. Fine. So she requested for home care services. making a request for the agency to provide healthcare services to the patient. Yeah. So you are requesting for home care service, healthcare services. You are requesting for healthcare services. So they will send a nurse or nurses whenever necessary. So the in charge or the manager will say. So it's not given, so leave it. If it is given, you write. If it is not given, leave it. Anyhow, there are 5 words here. So you'll write like this: Grace, Garon, your choice, home care, all capital letters. So that's it. So next, Leichhardt, Leichhardt. Be very careful. Next one is New South Wales. Be careful. Australia. So that's it. This is how you're going to write the address. Yeah. Fine. This is counterpart number 1. Component number 1 is called the address. The address. So whatever is given, write down. How to find out that, you have to be very careful. So 5 lines, roughly 5 lines. Okay. Okay. So number 1. Next, go for number 2. Come on, all of you. Come on, fast. Write down the address from here. I'm going to put it here. So write down the address from here in the chat box. Submit your action. I'm going to give you 4 or 5 letters now. I'm going to give you 4 or 5 letters, addresses you have to write now. Fast. I'll just pick up the information and I'll give you. So the address. Submit your responses. So you have to write in 5 lines. Come on. So write down in 5 lines. Then I'll give you another letter. Come on, fast. Fast. How to pick up information from different places. Come on, fast. Yes. Number 1 finished. Now we are going to component number 2. New South Wales, Azubike Elizabeth. New South Wales is wrong. New South Wales is right. Okay, next one, the date. This is the date. This is the date. So how are you going to present this date? 20 April 2018. That's all. This is component number 2. So that is the date number 2. Dates. Okay, you need not write this one, date. Just write the date, that's all. So this is the label. Okay, that is the label. No need to write the label. I change the color. This is yellow color and this is green color. Green color goes into the exam. This is from the case notes. Okay, green color goes into the letter. So that is number 2. Number 3 is salutation. Dear, okay, Miss Jerome or Grace is a lady. Dear Miss or Mrs. Jerome. So not given, it may be Miss or Mrs. When you don't know anything, just write Miss. Okay, when you are not clear. So this line comes from here. So here, number 3. Number 3 is the salutation. Number 3 is the salutation. That is, dear Miss Jerome, because we don't know whether she is Miss or Mrs. or Miss. I don't know anything, so just write MS. When you have a confusion, when you don't have any clarity, just write MS. Dear Miss Jerome. Where do you get this information from? From the first line. Dear and title and Jerome, second name. Okay. Yeah, dear Miss Jerome, Grace Jerome. So dear Miss Jerome. Okay, come on. As and when I'm telling you, you go on writing all these things. New South Wales, Lineon, New South Wales, you go to the next line. Because it's the name of a state. So the salutation. Then subject. Subject. Be careful when you write the spelling. Gerom, G-E-R-O-M-E. Salutation is over. Then you go for subject. Subject is here. Vanessa Stanley. Date of birth is not given. Only age is given. So write age. Okay, how you are going to write this? This is fourth one. The fourth component. The fourth component. You can write like this. RE regarding. So Vanessa Stanley. She lives alone, no children. Nothing is given. Okay. Not very much like authentic letter. But it's okay. Because in authentic letters like official OET, such confusion will not be there. 85 years old. We don't know whether she's divorced. Okay. Or she is a widower. Widow. Vanessa, lady. Whether she's a widow or divorced. We don't know anything regarding this. Okay. Yes, Dr. Satya.
Yeah, I mean, it clearly says in her social history that she lives alone. That
She
means
lives
she must
alone.
be either
It doesn't
divorcee
necessarily
or
mean that she's a widower or a divorcee. It doesn't necessarily mean she lives alone.
right. Okay.
Maybe they are separated. Maybe they are
No
divorced.
children. It
We are
says no
not
children
sure.
also, right?
That
Yeah.
is doubt, benefit of doubt.
Right. Got it.
Not confirmed. See, for example, when you see a lady, you cannot directly go and ask her, somebody is sitting next to her. Is he your husband? Then they'll get angry, maybe. When we are not sure, we cannot directly ascertain that thing. So that's why we have to be very careful, sensitive spots. We don't know. So better pretend that you don't know. Because
Right.
no
Got
merit is given.
Right.
That's the point.
Right.
Then again, so here it's not given. So let it be like that, as we don't know. If it is 100% clear, take it for granted. Okay. Her neighbor Maria visits her house often. There are some mistakes also in this case notes. It is not visit. Maria, her neighbor Maria visits her house often. So be careful, children. Sometimes there may be mistakes in the case notes also. Don't be confirmed that the case notes is 100% right. So anybody can say that neighbor Maria, M should be capital letter. See the case notes itself, there is a mistake. M should be capital letter, but it is small letter. How can the name of a person be small letter? I think you understand. So there may be mistakes. So here we have found one mistake. And Maria, her neighbor Maria, visits. So that's another mistake. That's another mistake. I am not telling, you know that one. I'm not telling something which you do not know. I'm telling those things which you know. So when you're taking case notes from anywhere around the world, be sure First judge whether it is authentic letter or not. Now, what do you mean by authentic letter? What do you mean by authentic letter? Authentic letter means a standard letter which is prepared by the professionals, which is almost foolproof. Almost foolproof. 99% foolproof. Nobody can be 100% foolproof. 99.9% foolproof. Okay. Some mistakes may be here and there. Devil's mistakes, maybe some typists do. That is different. But see, one line, there are two mistakes. Lives alone, no children. We don't know whether she is married also. But no children. So it gives some idea, some hint, but not sure. So forget about it. When you don't know, leave it. Just write Miss. Okay, we cannot say Mrs. So just write Miss when you have confusion. So Miss Vanessa Stanley, regarding because many case notes, you will have some problems like this. Okay, regarding R capital E small letter. Immediately, no space, no space. Immediately colon and then space. Okay, this is the space. Space will be after colon, not before colon. Regarding Miss Vanessa Stanley, comma, aged 85. Nothing more, nothing less. Don't write too much. This is enough. This is enough. This is enough. Now here, regarding the name of the patient and the age of the patient. If date of birth is given, write date of birth. Because date of birth is more concrete. Okay. It will give you a figure of years, months, and days also. So that is more concrete and more preferred. Okay, so write that one. Because today, if you hear these lectures, two lectures, nurses also can attend the doctor's lecture. It is one and the same. 95% same. Address is the same. Okay, salutation is the same. Date is the same. Everything is the same. Only the thing that you will be writing like a doctor, that's all. Okay, you'll be writing like a doctor, and nurses will be writing like a nurse, that's all. Otherwise, vocabulary same, grammar same, words same, spellings same, everything same. 95% same. Only the presentation will be like a doctor or a nurse, that's all. So don't miss the two sessions today. One is, this is the orientation for the nurses. Okay. And the next one is the orientation for the doctors. Many people think, oh, I am doctor. Why should I attend nurses? Nurses think, why should I attend doctors? Same thing. Wherever English is there, learn. Knowledge is knowledge. If you don't use it today, you may use it tomorrow. So you learn. It's grammar ultimately, vocabulary ultimately, and subject. Right. Now here, this is the fourth part. This is the fourth component. This is the third component. And this is the fourth component. And this is the fourth component, that is the subject. This is the subject. Yeah, that is the subject. Now let us see once again the 7 components. I'm giving you here after the things, the 7 components. Okay, so we have already finished with these 3 components, 4 components now. The subject, the salute subject or the reference. Okay, we already finished these things. These are the starters. And next one, these are the desserts. And this is the body. Okay, the body is in the center. So separate these 2 things. And the main body is more valuable, 80% weightage for this thing, and the 100% for the other things. Okay. Now 1, 2, 3, 4 finished. Now 6th one, the closing remarks. Here the name of the nurse is there. Name of the manager is there. Here the name is Grace Jerome and dear Miss Jerome or Jerome. So here point number 6, the closing remarks. Point number 6, the closing remarks will be like this. Name is there, then you will say yours sincerely. If name is there, then you will say yours sincerely. This is number 6. The closing remarks. The closing remarks. Okay. Now there are 2 types of closing remarks. 2 types of closing remarks. Now how can we identify these 2 things? On what basis? The basis is based on whether you know the name of the person or not. If you know the name of the person, you will say yours sincerely. Sometimes you don't know the name of the person and you say dear sir or dear manager. Yes, sometimes you say dear nurse, or you may say dear manager, or you may say dear sir. So you may be calling the persons by their personal name or professional name or a general name. So role name we can say. So you can call them by their personal name, Simon Peter, or professional name, teacher. Or nurse, or a doctor, or physiotherapist, or surgeon. Dear surgeon, dear nurse, dear doctor. Because you don't know the name of the person. You don't know the name of the person. And sometimes you don't know even the profession of the person. Then you will say, dear sir, or dear madam. Okay. Dear sir, or madam. So in such case, what are you going to do? In such cases, what are you going to do? Okay, in such cases, you will be writing yours faithfully. Remember that. In such cases, you will be writing yours faithfully. Remember that. This letter, this is not applicable. Okay. So yours faithfully. Comma. Okay. Right. This is how you are going to do. Now, next one is the sender's address, the sender's particulars. Now, where do you get the sender's particulars? You can see in the beginning. Read the case notes. This is nursing letter. Okay, read the case notes and complete the writing task which follows. Actually, this is not very clear. This is for a beginner who is preparing something, who does not know many things. Easy task, simple task. Okay, right. Now here, so patient requested for home care services. So you are a nurse. Okay, you are a nurse. And this is discharged from hospital. We don't know which hospital. Okay, we don't know which hospital. Remember that. But one thing is, okay, he was admitted and he was discharged. He was admitted and discharged. So it was a ward. So discharged from a ward, and you are the ward nurse, or you are a hospital nurse, or a ward nurse, or a charge nurse. Okay, or registered nurse. Okay, registered nurse. If it is an emergency, accident and emergency department, they can write department, accident department, emergency services, or emergency department. Whatever department say, you can say there. But nothing is related there here. Okay. So inpatient ward, XYZ hospital. Hospital name is not given. So leave it. So registered nurse. End the letter with just registered nurse. So you can have 5 things here also. So registered nurse. Before this one, you leave 2 lines. Registered nurse. I'm just putting in brackets. Inpatient ward or post-operative ward, whatever it comes out from the case notes. I'm putting here in brackets because nothing is given there. Okay. And it may be X, YZ hospital. So brackets. Okay. And Newtown, then Australia. Whatever they give you, write. It's not given. I'm just giving you an example. That's why I'm putting in brackets. If it is given, I'm not talking about this particular letter. I'm sorry, don't misunderstand me. I'm not talking about this particular letter. I'm talking in a letter in general, whether it is doctors or nurses or anybody else. If that is your concern, take any letter. So registered nurse, and before that, sometimes he will give, you are so and so. So name of this nurse, name, personal name. Sometimes they will give personal name. You are Miss Lisa Smith. Then write here Lisa Smith. Yeah. Personal name, Lisa Smith. If your name is given, write Lisa Smith. All those which are there in brackets or fictitious. That means whichever are given, you write. If they are not given, leave. Yeah. So let us see here. Only this is given. Only this is given. So write that one and leave. If these are fictitious, don't write this because you don't know. If it is given, you can write. If it is given, you. So recovering from the post-operatively, he has been recovering. Like that you say. Then it is post-operative ward. After the operation, he sent to the operative ward. Okay. Inpatient department or inpatient ward or post-operative ward or whatever. Okay. Is given, you write. Otherwise, you don't write. Just because I have put in here, don't write. You have to judge. You have to judge it. So that's it. I have put red. Brackets are red. So sensitive area. So whichever is okay. So 4 or 5 lines will be there. Whatever are given in some letters, they will be given. In some letters, they are not given. So accordingly, you have to write. Okay. So that's it. Fine. So we have completed the other than thing. So we have done the starters 1, 2, 3, 4. This is 1 address. This is 2 the date. This is 3 the salutation. And this is 4 the subject. And the body we did not go for that. And next one we are going for the closing remarks. And here it is. Okay. So that's the point. So these are the 7 different things which you have to notice. So this is the first one is the address. We have got that one, 5 different things. Then next one, second one. Number 2 is the date. When you are writing date, okay, when you are writing date, what you are supposed to do is you write the date in 1 digit or 2 digits. Not necessarily you have to write 0. It's not necessary. It's not compulsory. Right. So 8, just write 8. No need of 08. This is not computer generated sheet where you have to put 0. Okay, you can write or you don't leave it, no problem. Why 1 extra second wasted? To avoid it, no problem. Right, next one. So you'll write as it is. So the date and the month, the date in digits and the name of the month in words. Okay, the name of the month in words. For example, here you see it is 20 April 2018. 20 April 2018. So you can write, definitely you can write in any number of ways. You can write in any number of ways. But if you write like this, 3-7-2022, if you write like this, it is right. But do you know that in some countries, people write the month first and the date next? Mind you, there is no standard format for writing like this. So that is why, to avoid that, we don't know whether 3 is month or 7 is month now. Confusion, chaos. Because in some countries, left-hand drive, in some countries, right-hand drive. In the same way, right-hand drive countries, they write month at the beginning. Left-hand drive countries, write in the middle. Mostly, this is my jurisdiction. I don't know whether it is right or wrong. There is confusion. Is this 3rd July or 7th March? That's confusion. So be careful. Be careful. If it is more than 12, then it's okay. 13 means automatically date, but 12 means maybe month. So confusion. So for avoiding that confusion, the standard logic is anywhere writing it words, avoid it. So you can write 3 July 2022. That's better. Or if it is 7th March, write 7 March 2022. So name of the month should be written in words, not in digits. That is the standard. If you have any doubt, you go to the official letters. You go to any official. I have here 8 letters, official letters. You see 8 letters. Official, any official letter you see, it will be written like that only. See, this is one official letter. You can see official sample. Many people will say, oh, it's okay. You can write whatever manner you want to write. You can write okay, okay, okay. That teacher is okay. That student is okay. Everything is okay. Okay means ordinary, mediocre, average, normal, usual, regular candidates. If he can prove why it is right and why it is wrong, ask them. Ask them why many people are writing like this, which is the best. Apply your common sense. Don't accept everything. Okay, sir. Yes, sir. Okay, sir. Yes, sir. Don't be stupid. Be wise enough to ask. A person who never asks is a stupid fellow. A wise person always asks questions. Even children ask questions. Mama, why is the moon not falling down? Why is the moon not falling down? Okay, who put the moon there? So all these questions, why even a child is asking. Asking questions is the sign and symptom for being wise. Only stupid people says, oh, okay, yes, okay, yes. Now you have to decide whether you are stupid or you are wise. So if you are wise enough, you ask questions. Whoever tells you something, you ask them why. How can everything be okay? Never. Everything will not be okay. Only something will be okay in some situations. The other things will be okay in some other situations. Everything is not okay. That's the question. A person who says everything is okay is an ordinary person. So something special, identify that special. Okay, okay, sir. What you say is okay. This is George in Ponsford, letter number 1. Okay, fine. That's clear. See here, 5 lines. Many people say date first and address next. Okay, sir. Okay, sir. Many people write like that. I'm going to prove that one also now here. You see here, address first and date next. How can you say okay? This is official paper. This is official paper. Okay, sir. Then first letter, okay. What about the second letter? Okay, Peter Dunbar letter. What about this one, sir? Is it the same thing? Rule applies here also. That is the rule there. Then how can many people say it is okay? I don't understand. Okay, you should have that pain. You should take that pain to learn something from the boss. Who is the boss? OET is the boss. Anybody, somebody is passing OET. I passed OET. What you passed? Did you pass everything? No. You ask, you will find out. Show me your certificate, you'll find. I passed writing. I'm teaching writing. I passed speaking. I am teaching speaking. And nobody teaches reading and listening. Why? Because they're very difficult. Nobody can teach you reading and listening. You have to prepare on your own. Nonsense. Are there teachers in the first place who said nobody can teach reading and listening? Then why is it a subject? And how can you learn if nobody can teach? Okay, you have to ask them. Oh, okay, teacher, very good. I will try on my own. Baba, black sheep. Huh? Fine. Now here, see, date is in the second place, address is in the first place. Second letter. This is first letter, and this is second letter. Fine. Awesome. Now what about the next letter, sir? Okay. Jake Peterson. Third letter. Is this the same, sir? I don't know. You check it for yourself. Why should I tell you? You have eyes, you have brain, you have wisdom, you have knowledge. Moreover, you are a live dog, not a dead lion. Okay? A live dog is better than a dead lion. What do you mean by live dog and dead lion? A live dog means life is there in that. Human beings are not compared to live dogs and dead lions here. There is no comparison. It's an idiom, a quotation, a saying. A live dog is better than a dead lion. So that's a comparison. That means you are a lion, but still you are dead. What is the use of your bravery, strength? Because there is no life in you. You cannot do anything. You cannot do anything. A lion can kill a human being, but lion is already dead. What it can do? If nobody, even a rat will not be frightened because of the dead lion. Try to understand what I am talking. A live dog, if it cannot bite, at least it will bark and frighten the thieves. Some use is there. So remember that, what I am telling you. Okay. Don't be, okay, put down by your teachers. Learn something from the boss. Who is the boss? Official OET is the boss. Learn from it. This is the third letter. Okay, sir. Third letter. Fine. Is that the same thing for the fourth letter? See here. That means these teachers are excellent and OET is mad or what? What do you mean? Teachers are saying, okay, you can write address first, date first or address next. No problem, no problem. Okay, no problem. Many letters I have seen like that. What is this? Can you see the phenomenon which is presented there? Okay, fine. When in all the letters, there is a phenomenon, there is a pattern. And what are these things? What do you call this? Is it not madness to believe somebody when they say you can write date first and address next? You mean there is no order? Anybody can teach anything. Learn from the boss. And your boss is OET. Don't manipulate things just because some Tom, Dick, and Harry taught you something. Don't take it for granted. Don't be tricked or fooled by people who just say anything is okay. They are trying to escape the pain and the suffering to teach you. If you say, okay, no problem, finished. Why headache? Why to explain all these things? Because they themselves cannot prove you. They themselves don't know solid idea, maybe. Okay, see 5 letters I have shown you. If you want, I'll show you number of letters. That is not my problem. That is your problem now. I've already given you 5 examples. And second thing, you see, I'm coming back. May is written in words. May is written in words. Fourth letter. August is written in words, not numbers. The next third letter. August is written in words. Second letter. January is written in words. First letter. February is written in words. Now, why this? Many people write many different things. Sir, we'll write slash, we'll write this one, we'll write this one, and we'll put numbers. And the year should be in four digits. Many people will write in 2 digits. No, formal letter. Yeah, this is not notes. This is a formal letter. And every letter in the ending, there are instructions. Do not write note form. Do not use note form. Not. Do not use note form. Don't write note form. In short form. Then full 4 letters. Why you are writing 2 letters? 2 digits. So do not use note form. Expand the relevant notes. BD. BD means twice daily. Why are you writing BD? Why are you writing BD there? So you have to be cautious. I'm teaching the basics and rules and regulations. Just follow them. In every letter, you have to follow them. I'm not going to teach you these things every time. I will slaughter your letter. I'll butcher your letter. I'll chop your letters to pieces. And I'll show you all your mistakes as far as possible. Because I'm human. I cannot do everything. But still, as far as possible, I'll do. So you have seen, okay, all these things. Whatever I have shown you, you have noticed. Address first, date next. Then date, name of the month in words. And year in full, 4 digits. I have to write like that. Now, come on. This is the letter. Only little is there, not too much. You can see here. Okay, telephone number, no need. So here, social history. Okay. You can see all these things. Come on. Now, here you have introduction. You have to write an introduction. So now the case notes is in front of you. Write an introduction. Making a request for the agency to provide healthcare services. A request for the agency to provide healthcare services. So this is the request. Provide healthcare services. Okay. Yeah, there it is. Come on, write the introduction to this letter. Whether you're a doctor or a nurse or anybody. Introduction is introduction. I'm giving you, yeah, 2 to 3 minutes. Come on, write down. All of you write the introduction. Or what you can do is write sentences whichever you want. Write as many sentences as you want. No need any introduction. Just prepare sentences. Just to prepare sentences. What I want you to do is make some sentences. Her neighbor Maria visits her house often. Don't copy the same sentence. Take this. Okay. Now I am taking this sentence. I'm taking this sentence, and what I'm going to do is, okay. So copy text. Okay. Her neighbor Maria visits her house often. Now let me show you something. Vanessa Stanley. Okay. So I think you understood what I have done now. Okay. I think you understood what I have done now. Now Vanessa Stanley, I wrote Vanessa, I wrote, and Stanley's half I wrote. Then afterwards I realized that V I did not put capital letter. So immediately I erased everything and I went back and started with capital letter. So this is how you have to check and cross-check your work to correct your mistakes. That's what I'm telling you. No one is a master. Nobody can be perfect. So if you check and cross-check, and if you are a little bit careful, and you can do everything perfectly, no problem at all. Okay. Now here is the point. Her neighbor Maria visits her house often. So now Maria, comma, who lives next door, Maria, who lives next door. Neighbor means next door. Something. Change your words. Maria, who lives next door, okay, is a frequent visitor. Finished. Or visits her frequently. Like that. Change your style. I hope you understand now what I'm telling. Her neighbor Maria visits her house often. Maria, who lives next door, is a frequent visitor. So try to modify. Neighbor means who lives next door. Instead of neighbor, okay, who lives in the neighborhood. Okay. The neighbor, Maria, visits her frequently. Okay. So frequently visited by Maria. So who is frequently visited by Maria? Vanessa. Okay, sorry, Stanley. Miss Stanley is frequently visited by Maria, her neighbor. So this is passive voice. So third sentence is passive voice. First sentence is active voice. Second sentence also is active voice. Third sentence is passive voice. Miss Stanley is frequently visited by Maria, her neighbor. So this is how you can make some sentences. Now what I am going to do is write as many sentences as possible. I am giving you just 3 to 4 minutes. So you can write 5 paragraphs here. So what are the 5 paragraphs? I'm going to show you. Okay. So the 5 paragraphs are, the first one is introduction, body, the body. This is 5th one, the body of the letter. Okay. First paragraph is the introduction. Second paragraph you will write about. Third paragraph, fourth paragraph, and 5th paragraph. So the conclusion. And 4th paragraph is post-discharge. Post-discharge response. Okay. Post-discharge responsibilities. Or you can say discharge plan. Focus on discharge plan. What are these? What after discharge? What? After discharge or discharge plan. So after discharge, what you have to do? And second one is give the detailed information. So the problems. That is number 1, the problems. And next one is the other important things. The other important things you can write. So the main problems. For this letter, you can write like this. So, right. The introduction, the other important problems. Okay. Discharge plan and conclusion. Okay, now here there are different styles based on the information given. What information is given, that one. If only one problem is there, write one problem. And the next one will be personal history, social history, family history, or his habits, or other things will be there. So you can write that one. And then discharge plan. So accordingly, you have to plan. This is called organization of the letter. Which comes first? Which comes next? Which comes first? Which comes next? So here you will write about this person. Now, what are the problems, the medical problems, the other important things, then the discharge plan, then the conclusion. So now you see here, this is family background. Okay, this is medical story. Okay, then next one. So this is future, recommended for future. Okay, weakness and limited physical abilities, personal care is recommended. So what you are supposed to do? Okay, you try to understand these things. Try to understand these things. Okay. So, and conclusion, you have to write. So in the introduction, what you have to write? You have to write the name of the patient and status. What is the status? 7 different statuses are there. Number 1, signs and symptoms. Number 2, preliminary diagnosis. Number 3, signs and symptoms, preliminary diagnosis, presented or visited, presenting to the hospital or visiting the hospital. So preliminary signs and symptoms, preliminary diagnosis. Better I write, otherwise you'll forget. So the 7 statuses, the 7 stages. Okay. What are they? Number one, the signs and symptoms. We don't know anything. We only know the signs and symptoms. Number two, the preliminary diagnosis or the visit or presented to the hospital or visit the hospital. Presentation. So he presented to the hospital or visited the hospital. That's the second stage, because he has signs and symptoms. Because of that, he visited or presented to the hospital. Number three, the preliminary diagnosis. Doctor, preliminary diagnosis, not confirmed, because the doctor is not a specialist, so he is diagnosing based on the signs and symptoms. Preliminary diagnosis, that's the third stage. And the fourth stage is diagnosed, the diagnosis. He was diagnosed with pneumonia. Then fifth one, because he was diagnosed with pneumonia, the admission, he was admitted to the hospital because of the right total shoulder replacement, osteoarthritis of the right shoulder became serious. So that was diagnosed. Therefore, he was admitted. First signs and symptoms, then visiting the doctor, then preliminary diagnosis, then the diagnosis, then admission. After those 1 or 2 visits, then diagnosis. Then if it is diagnosed, then admission. Okay. Sometimes here and there, don't think that that is the perfect order. Then next one, the sixth one is undergoing surgery or undergoing the surgery or the treatment. Or the therapy, whatever. The surgery stage or the treatment stage or the therapy stage. Okay. Right. And then the seventh one is the recuperating stage or the recovering stage. So these are the 7 stages. Okay, the recuperating stage. All are stages only. Okay. So any one of these 7 stages you can write there in the introduction. Then you have to say whether it is a referral letter or a discharge letter or a transfer letter. Is being transferred or is being discharged or is being referred. Don't write I am referring, I am discharging, I am transferring. Don't put yourself more important. You are not important than the patient. Patient is more important. Don't say I am transferring, I am registering, I am referring, I am transferring, I am discharging, I am writing to refer. All these things. Of course, nonsense, beating around the bush. Because you don't know what is quality, you are writing everything nonsense. So you are not important. Right? Don't put yourself into the picture. If you don't realize, go to the boss. And who is your boss? Is the official OET. Just ask official OET. Any question you have, you write official OET and then say active or passive voice in writing and speaking. Now we want only writing, no speaking. Okay. So now you see here. Do you know how to write passive forms correctly? Do you know how to write passive forms correctly? That means passive forms are important. Passive forms are very important. Not only writing passive forms are important, is important. Writing passive forms correctly is very important. So do you know passive forms? Do you know how to write passive forms? Do you know how to write passive forms correctly? That means passive forms are important. Writing passive forms is important. Writing passive forms correctly is very, very important. Otherwise, he is not mad to ask you, do you know how to write passive forms correctly? Somebody comes and asks you, your son, suppose, daddy, where is the supermarket? Then what does it mean? That means he needs a supermarket. Daddy, do you know where is the supermarket? That means what? That means what? He wants it. Okay. Daddy, do you know how to solve my problems? Means he wants the problems to be solved. So he wants his help there. Do you know where is Eiffel Tower? That means he wants to know where Eiffel Tower is. Whether you know it or not. And he wants it. And he wants to know whether you know it or not. So he's questioning you because he wants you to know that it is there. He's testing you whether you know it or not. That's why he's asking you. So official OET, www.occupationalenglishTest.org. Do you know how to write passive forms correctly? Passive forms are great. Passive forms are great. I don't know how to write passive forms, sir. Then learn. Learn. Simon sir is teaching too much passive voice, too many passive voice sentences. Very difficult. Okay, leave Simon sir. You don't want, Simon sir will not trouble you. OET is asking you to write passive forms. So I am teaching you passive forms. Huh? Passive forms are great for making the patient important, for making the patient the focus of a sentence. And you are saying, I am writing to refer. So you are the focus of the sentence. Why? Are you so great? Nobody else can refer the patient. I am writing to refer Miss Vanessa Stanley. Only you alone can refer Vanessa Stanley. Nobody can refer. Any nurse can refer. So what is your greatness in this? Why are you bringing I into the middle of this sentence, to the beginning of the sentence? Why is this I the king of the sentence? Why don't you make Vanessa Stanley the king of the sentence? Instead of that, pushing forward. Vanessa, go far. I am important. I am writing to refer you, Vanessa. So I is important. You is important. And last importance to Vanessa. How useful your writing is. How valuable your writing is. How sensible your writing is. You realize. Vanessa Stanley is the most important person in the lesson. And you're kicking Vanessa Stanley to the far end, into the third position. I am writing this letter to you regarding Vanessa Stanley. Nonsense in the first place. Foolishness, idiocy, ignorance, lack of knowledge. Whatever you want to tell, you can tell. I'm not telling. You can see what it is telling here. Passive forms are great for making the patient or treatment the focus of the sentence. Then why are you making yourself the focus of the sentence? That is what OET is asking. And more than that, using it during writing and speaking subtest can help your language be more sympathetic. You have to be sympathetic. You will know empathy, love, affection, kindness. When you say, I am referring, it shows that you are proud. You are self-centered. You are bothered more about you. You are less bothered about the patient. It is not sympathetic. You have to be sympathetic towards your patient. Okay. See this person, when she is treating the patient, she's bending forward. She's standing straight. No, she's bending forward. That means you are important. What do you mean by we have to give out a low profile? There are some doctors who treat these patients like this, sitting like this, and okay, come here, give me. Why don't you bend towards your patient? That is called sympathetic. Put yourself down and lift the patient up. Make him very great. Then he will be very happy to disclose your secrets with, oh, this doctor is very nice. He likes me. So nicely he talks to me. So I should tell everything to him. He is going to support me. He is going to treat me. He is going to make me well again. I'm getting confident because the way how doctor's behavior is towards me. That is called sympathetic towards the patient. Make the patient the focus of the sentence and make the treatment. Yes. A nurse, as nurse, you can use your language to build better relationship with patients. If you say, I am writing this letter, that means you are posing yourself as great. Okay. Right. So, therefore, avoid that one. And instead of pitting the performer of the action first, that means I am writing, you say, use the passive voice, makes the person or thing being acted on the subject of the, make it the subject, bring it forward. Bring it forward. Vanessa Stanley. Vanessa Stanley. So bring her forward. Is being referred for ongoing monitoring and appropriate management following the discharge back home today. Miss Vanessa Stanley. Miss Vanessa Stanley. Bring it forward. Make it the subject of the sentence. Very powerful. You'll get B grade, B plus. Definite. Miss Vanessa Stanley, comma. Okay. Miss Vanessa Stanley, who is being discharged from the hospital back home today, requires, comma, requires health care services from your facility. Finished. Following the discharge back home today. You can remove that one and put in the far end also. Miss Vanessa Stanley, comma, who has been weak and has limited physical abilities, comma, requires health care services from your facility following the discharge back home today. Finished. So try how you are writing. That is the introduction. Very good. Number of students. Yes, this Folidare. Who is this Folidare? Where are you from, Folidare? Yesterday also you were attending. Very good. Very good. Very good. Number of, yeah, number of sentences I can see there. Very good. So, Folidare, L-I-M-H. Unmute, please. I want to have a word with you if you don't mind, if you're comfortable. Folidare. Can you unmute, please?
Yeah.
Yes,
Well
Folidare.
done, sir.
Yes, where are you from?
Yes, sir. I'm from Nigeria.
Oh, you are from Nigeria. I have a big base in Nigeria. I have a number of students from there. Okay. You are coming for the second time today, yesterday and today. Very good. Welcome to our platform.
Yes,
I
sir.
appreciate. Are you a doctor or a nurse?
I'm a nurse, sir. Thank you,
And
sir.
what's your original name? Is that your original name?
No, I'm Folake Awodire.
Okay, fine. That's fine. That's fine. Right. Very good. And how do
Thank
you
you,
find
sir.
our sessions? Were they useful or not?
It's been helpful.
Huh?
It's been very helpful and
I don't think
educative.
this much is required for you, right?
Yes, sir.
Should I reduce the length and quality, or is that okay?
It's okay. It's okay. It's very okay.
Is that okay, or is that very much needed?
Yes. It's okay. I'm
Okay,
very
fine,
comfortable
fine.
with it.
Right, right. Now, Dr. Satya Kumar. Hello, Dr. Satya Kumar.
Hey. Hi.
Yes, dear. I want you to share your experience. This is your first session.
That's
Okay.
right.
So you have paid 15,000 for 1 month as a doctor, and
Yeah.
are you getting the quality which you demand, or you are under provided?
No. I think I'm fine with whatever, but I feel it is a bit lengthy in few aspects. But nevertheless, it's okay. I don't mind since I have time. I'll be able to listen to whatever minute details you are talking about.
Yeah, of course. Thank you very much. Because this is the first session.
That's right.
This is the first session. I'm giving you the orientation and an explanation and a general idea. So I have to give all the foundation. Okay.
Yes.
So
Yes.
once
Yes.
after this is done, next sessions will not be this length. Okay.
Right. Fine. Fine.
But for the new students, this is very much necessary, right?
Yes. Yes. Absolutely.
Okay, fine, fine. Right. Okay, thank you very much.
Thank you.
Then next. Yeah. So you have written this. So this is the way how you can divide. So the introduction, the main problems, the other important problems, that is, or the social history, medical history, and the personal history, whatever. So you, the other important things or histories. Sometimes you'll get histories also. Medical history, social history, personal history, like that. Whichever, that goes into the third paragraph. And the last one is discharge plan. Depends on type of letter. This is not standard. It should be flexible, but the order will be almost always the same. Right. So now we are moving on to a letter for the doctors. I'll send you a new link, and you can join the link. And if you cannot get the link, and by any chance, I'm giving you. And if there are any new students, I'm declaring 2 more places are remaining. 2 more places are remaining for nurses. For the 1 month course, it is 10,000, and for the full course, 100 days, it is 15,000. And 1 place is remaining for the doctors. That is 15,000 for 1 month and 25,000 for 3 months. So if anybody is interested, you can get back to me. Okay, only 3 places are there: 1 doctor and 2 nurses. And this is my WhatsApp number. So if you miss to get, because I'm going to teach you Now here I taught you about the essentials. Now in the doctor's letter, I won't teach the essentials, but I will teach you how to write the sentences. Orientation, already I have given now. Organization, I'm going to give you. How to make them into paragraphs. Then how to write sentences, I'm going to teach you in the doctor's letter. I told you once there, one here. Is the same thing. So we are going to deal with sentence constructions in the doctor's session. So this is not purely doctor's session. I'm not teaching doctor's letter here. I'm taking doctor's letter as an example, and I'm teaching you how to write sentences. I'm not teaching letters either. I'm teaching you how to write sentences. So don't miss the show. So this is my link, whatsapp.me. Copy link. If by chance you don't get the link, then you can immediately message me and I'll give you. This link which is going to come is only for the regular students and the interested student, not open, because it's a very special session. So don't share that link with anybody else. So this is my yes. So that will be purely regular batch students. Okay. So I'll be sending the link, and don't send to everyone. Okay. Those who are really serious and those who are attending this session, they can get this link, and not to others. So don't share with anybody else. Now, last point is your feedback regarding orientation. This is orientation. Only where is what other than, okay, basics regarding the session. Yes, okay, Jennifer, you can join, no problem. Yeah, give your feedback, please. So the actual session is only 10 minutes. The coming session, actual session is only 10 minutes. Just 10 minutes. I'll explain. Then afterwards, you can start with that and you can write the letter. And nurses who don't want to attend the doctor's session, you can write this letter and you can submit. Okay. So you can give your feedback, valuable feedback. Please provide your valuable feedback in 3 sentences maximum. 1 sentence but 3 sentences maximum. Okay. Now the link. Okay. So this is my WhatsApp link. You can message me. And today we are going to learn the lecture for doctors. Okay. So we are not going to learn about address, date, salutation, subject line, closing remarks, and the sender's address. We are not going to bother. We are going to concentrate on the body of the letter, and that also only writing sentences. Okay, we are going to learn, like yesterday, nurses, we have learned 17 sentences. Like that one, we are going to write. Yes, Saranga, your admission is confirmed. That's why only 2 seats are left. Yesterday, I told you 3 seats are remaining. So you got your admissions. Saranga Dariya from Saranga Ranavira from Sri Lanka. Yes, your admission is confirmed. I got your payment just now. Right. So all the regular students can attend the doctor's session. It is only 10 minutes and finish. That's all. 10, maximum 15 minutes. Afterwards, we'll be concentrating on how to write sentences. What is subject, how to write, what passive voice and everything. Quality, improvement, all these things. So regular students, all the regular students can attend. All the regular students can attend. Non-registered students can request. Non-registered students can request today if you are interested. Request for the link. Okay, that's it. So now it is 9 o'clock, 10 minutes to 9. So it is 8:40. Sorry, 8:50. Sorry, 8:50. So a break of 10 minutes for me. And exactly 9 p.m. after 10 minutes, 9 p.m. session for the doctors. Session for the doctors. And here is the doctor's session. Medicine tasks. Annie Hall. So I'm going to teach Annie Hall. So I'm not going to teach. I'm not going to take the case notes and all. I'll just go fast, and I'll give you information. And then immediately we'll go for, okay, the sentences. Okay, how to write quality sentences. Okay, how to write quality sentences. Okay, if you see Miss Hall so many times, that means that is active voice. Okay, I am referring Miss Hall, active voice. Okay, so see here, she. Now you see how many times she is there. That means this is very weak. Very weak. She. In our letter, will not have this many she's. Okay, her. I. Okay. She. See what I'm showing you now. Her. All these are personal pronouns. She. I. Okay, Miss Hall. Miss Hall. Miss Hall. Miss Hall. Every paragraph, one time Miss Hall is there. See, why only one patient? Why to take the names of the patients so many times? There is no need. So, okay. So, right. 10 minutes. Okay, 7 minutes remaining. So, we are going to join shortly. Right. That's the end of the session now. I'm going to send a new link. You can join from there. Right.